have the patient bend his knees. Alright. Next thing we need to do is get this out. And I don't know about you, but for a while, the barred people, their thing was like so loose it would just almost fall out. And then I guess they took what their customers were saying. It's like they cemented it. It's just ridiculous. See? It's hard to open. Huh?
It's probably vacuum packed it,
Ah.
the hole.
Okay. Oh, really? You can show I can't even open a bag? Look at the wheat. Now, look at this. Is this sack? Yeah. I need help. I need another nurse. Oh, no, I got it. Yay! Okay. So, I happen to be right-handed. Okay. All right, guys, so why don't you all try to scooch over here while Dr. Sloan's videotaping so you can see. You might have to stand up. Okay. I am right-handed. That means I'm going to be using my right hand for any fine motor stuff, so I'm going to stand on the right side of the patient's body. If you are left-handed, you want to do the opposite, okay? Because you're going to get close enough to this patient and you're going to have to use one hand that's going to not be sterile. For me, it's my right hand is fine motor, left hand is not, okay? So, I want you to look at this box. This shiny part is going to go on the bed frame, on the bed itself. Okay? It's going to be away from the patient. So it is not going to stay sterile. That's one. Two, when you set this up, you want to set, there's a flap here. You want to set that flap towards you. Because the very first thing you're going to do is open it away from you. Okay? So first, now guys, if you can't see, go ahead and stand up, get closer, whatever. Okay, so first thing I'm going to do is as I open this up, now remember, we can't cross over a sterile field. But think of this, kind of like, remember when we did our gloves and the cuff was going to go onto our skin, so it's going to be non-sterile anyhow. So when I open this up, that has to stay sterile. Even though I reached over, this is going to be on the bed. I'm not too worried about it because it's going to be on the bed now. So I'm going to now I can either leave this here, or if I want to, it then becomes non-sterile. So I'm just going to leave it here for right now. See, and this is what the problem is with these. As long as it's not been touched, and there, okay. The next product that you have there is a sterile field. So we've got to get the sterile field under the patient, okay, in a sterile format. So if you recall, getting 1 inch around the corner. Now what you'll see is you'll see clinicians who do this, and next thing you know they're going. Well, if you do that, you have a chance of doing this. Okay? So just open it up. One side is a shiny part. The other side is the absorbent part. Okay, now as I'm lifting it here, this is not what you're supposed to be doing. Okay, but just to show. I need to get the shiny part under the patient. Bed down. So, I want you to remember we did these, they sterile, my friends? Right? Okay? This is like a matador. Okay? So you are going to bring it underneath and leave it there for right now. That way I didn't cross over any sterile film. What you will see, however, which is incorrect, you'll see people do this. So what's wrong with this?
Your arms are burnt.
Exactly. Okay? So this is not sterile. Even though I'm touching only the 1 inch corners, excuse me, 1 inch border that's not sterile, by doing this, I have just contaminated my field. So what you want to do, matador, and just let it fall. Because I'm going to get, in just a second, the gloves. And I can fix everything up. Because remember, sterile to sterile, sterile. Okay? So since this guy doesn't stop flipping, there. Okay, so now I'm going to get those gloves out. I'm going to fix everything else after. If the gentleman can, the patient, I'll have them lift their hips up a little bit and I can tuck it under. But as long as I take it right up against the buttocks, we're fine too. Okay? So I'm going to get the gloves. And for checkoffs, this is where you can get the gloves that's your size. Okay. So sterile gloves, holding onto the cuff. All right. All right, remember sterile is sterile? I can fix everything. Okay. So now I can choose to put this down if I want, all pretty. This is a fenestrated drain. This is an option that nurses or whoever's doing this can do. Ideally, it's a really nice addition because it provides a sterile area. And so like now sterile to sterile, I can touch anything I want here. But it's optional. My personal preference, is not to use it. Because usually this kind of happens and gets in the way. But it can be used for male or female. If you choose to use it, you may. Okay, I am not. All right, so for our simulators, we cannot use the actual betadine, nor can we use the actual lubricant. So we have to simulate that just for checkoffs. But obviously, while you've identified your patient early on, you're going to find out if this patient is allergic to iodine. If they are, there is some other, depending on the facility, will be something else that you can use. God bless you.
And shellfish. Being allergic to shellfish, you usually cannot have iodine because it's the same kind of. I know because I'm allergic to shellfish and you can't use iodine.
Yeah, it doesn't mean you will be allergic to iodine. You just have a higher propensity.
Yeah.
Okay, so I'm going to pour, I would simulate ripping the container, putting a little bit there. Now, remember when we talked about maintaining sterile so that if it's above my waist, this is sterile, okay? That's why when you get ready, and I always prefer having a biohazardous container one side, and over here is a non-biohazardous container, okay? So for everything else. Anything that touched the patient, I throw in here. Everything that didn't, I can throw in here. If it didn't touch the patient, and I can throw it right here as well, okay? But remember, when you're throwing things away, you want to throw them from up here and let it drop. And people, I've had some, well, but if it's below the waist, right? Right. But if I bring my waist down, no, okay? It's from here, okay? So simulate that I open it, pour it here. I don't want to make it so saturated that's dripping, just at least wet enough. Drop. I'm going to simulate for purposes of our thing. I'm going to put some lubricant here. Drop. Okay. So now comes a time where I'm going to check the Foley first. Sterile to sterile. And now the Foley comes packaged like this. Okay, everybody see that? Alright. So, I need to, if you look, well, I don't know what number it is, hospital policy? 18. 18, okay. There are some facilities that allow you, expect you as a clinician to check the balloon and that it works, it doesn't have any leaks, okay? There are facilities that don't. As an example, the VA, they have silver infused Foleys that if you inflate the balloon and then deflate it, it gets all crimped and there's some issues with insertion. Some facilities believe that just like any balloon, if you fill it, unfill it, fill it again, you have a higher chance of it breaking and leaking, okay? Some facilities believe that you need to test it before it ever is inserted into the patient. Depending on the facility, you'll have to abide by that, okay? But let me demonstrate a few things. One, most of these will come with a covering around it. So you've got to be real cautious as you get this covering off because this Foley can flip and easily become uncontaminated. So let me show you what I prefer doing. Slowly bringing it out. Because some nurses and clinicians I have seen will do something like this. Okay? So you want to just be real cautious and realize that this Foley is quite pliable. And I keep it there. And then this, trash. Okay. So, I'm going to undo the container here, which is saline, insert it here. So here is where, as I infuse it, it's going to inflate the balloon. So if you look, I can't remember what number it is. Do me a favor, let's move that page a little bit that way. Okay, so, all right, you see number 28? We're going to talk about this in just a second. Guiding the catheter gently 1 to 2 inches beyond the point at which urine flows. This is the reason for that. I want you to see the catheter, and I want you to see the hole as it is, close to where the tip is, okay? So everybody look at the hole where the tip is, okay? You see how close that is? Okay. Let's pretend above my hand here is a bladder. So I insert it, and just right here, I'm in the bladder, and you see how close that hole is? The second I'm in there, urine's going to come out. The second. The problem with not inserting it further is that the balloon is down here. So let's say I insert it, I see urine, yay! I'm going to inflate the balloon. The balloon is not in the bladder. It's in the urethra.
Ouch.
Ow! Right? And that's okay if a patient is, not okay, none of it's okay. But if a patient is conscious, they can let you know real fast it hurts. What if you've done this to an unconscious patient? Right? Okay. So, let me just engage the balloon. So, what you want to say is, I see urine, and when it really happens to patients, because our simulations do not have urine in them for you to see. I see urine, I'm going to insert 1 to 2 inches further. If you do that, what you've just done is made sure the balloon is in the bladder. So if I insert it here, so here's the bladder, and now I gently secure it. All's well. In bladder, good. Not in bladder, real bad. Okay? So, I wanted you to have a visual, so that's why on number 28, when we say guide catheter gently 1 to 2 inches beyond point at which, because how close proximity this hole is to that tip means that as long as it's right, this point is in the bladder, you're going to get urine. And it's falsely letting you know that you are really way in the bladder. I mean, you're in the bladder, but just at the edge. Okay? So, here it goes. So now I've ensured that the balloon can inflate. Okay? Sterile, sterile. Now I've got to make sure that I cleanse the area. Once I do that, this hand is no longer sterile. Okay? So I'm going to place my hand on the head of the penis. Now, you are never going to see a meatus that looks like this. Okay? But what you are going to do is you're going to have to be pulling down upon the head of the penis so that the meatus opens so you have better access to it. Again, it would never look like this. Okay? While you are doing this, you cannot let go of this hand now, including the force that you're holding the meatus open, until after you start inserting the Foley. Because once the skin comes together, done. Okay? You have to start again as far as cleaning. So, this has betadine. Okay? I'm going to go to the meatus, one around, not in our video went, and then did this little back and forth. No. Okay? Here, around, and then in the video it went over the field to throw it out. Well, you just totally contaminated the field. So the right way, here, around, being careful not to get yourself, and just at this length, just let it go. Next one, here, around. A minimum of 3 is required, but if you wanted to use all the cotton and continue doing that, that's fine. Okay? So, next, I'm going to get this Foley, and where I had put the lubricant, I'm going to lubricate it. Okay? And then it just makes it so much easier. I'm going to bring this whole box closer. And then right before I insert it, I'm going to instruct the patient, as I do, whether it's an IV, an injection, NG, Foley, I don't care what it is. I'm going to say, Mr. Smith, when I tell you to, I want you to take a deep breath. So that while he's doing, I'm inserting it, he's paying attention to the deep breath, okay? So, Mr. Smith, take a deep breath, and he goes, and I start inserting it. Now, I am trying to keep my finger away. I don't want to bring the Foley all the way to the head of the penis, because now I'm contaminated. I'm pulling it away. I see urine. I'm going to put 1 to 2 more inches. Now, for our simulators, you may not be able to, just the simulator itself, but you're going to voice this, okay? Now it's time for me to secure the Foley, meaning inflate the balloon, okay? Because this Foley is now no longer going to keep going that way, I don't need to maintain the sterility of this outside, because most of this will probably come out. I can hold on to it here so that as I inflate, it's not pulling out at the same time. Keeping my finger onto the plunger, I twist it, and now gently pulling it out, just so that the balloon that you saw I demonstrated earlier is just sitting right there at the opening, okay? Usually this will come out a lot more, again, to see anatomy of the simulator itself. Okay, so now what I need to do is put the bag over here. Now these are all nice and dirty and usually betadine filled and whatever. Take that off. Go get clean gloves. Cleanse the patient, because let me tell you something, if you've ever seen betadine, if you've ever had betadine on you, it's sticky. And especially if it goes, a lot of times it'll go on the scrotum, it'll go on the anus. Just have nice warm cotton, a washcloth or something. Clean the patient. Whatever product your facility has, you're going to use it to secure to the leg, whether it's tape, whether it's it's a great thing. It looks like a belt with Velcro and it secures it, because you want to make sure this isn't just dangling, because that could really cause some problems. And the least thing you want this to do is be yanked out with a filled balloon. Okay, I'm going to open this up, and then I'm going to go on the bed frame. So this is a stretcher and it has stuff here. Okay, clean the patient, remove all the stuff. I'm going to keep it there because I want to show you female in just a second. Bring the legs down, and next thing I'm going to do, if you look, measure and record urine output number 36. I want to know the intake and output immediately, not an hour from now. As soon, while I'm doing this, before I'm finished, I want to know how much came out. There's reasons we put Foleys in people. Primarily, we need to know what's coming out. Whatever's function, whether we're worried about kidneys, whether we're worried about hypovolemia, I don't care what it is. You and I want to know what the output is. We want to know color, clarity, any characteristics. So is it a bright yellow? Is it amber? I don't know. Does amber mean hypovolemia? Does it mean there's some blood that's not bright red that I can't see? I want to know if there's any kind of sediment, precipitate, anything that's in there. Okay, you and I are going to document that. Then, as you notice, you're done as long as you maintain sterile technique. Okay, so let's say, let me now pretend this is female. Hold on. We'll change the anatomy in just a second.
Is it removable or just take it off?
All right, so let's pretend we are still at this phase. And okay. Let me assure you, you will never see a meatus that looks like that. Okay? Ever. Okay? What you're seeing here is actually spreading the labia, because this is not a normal way. Okay? So, we will. And I've got the female Foley. The only thing you're going to see is a difference in how you maintain and manage the actual cleansing. Okay. So, let's pretend. Bless you. Oh, I got that. Okay. So, again, we've checked the Foley. We've checked the bless you. We've checked the balloon. We've got this all filled. I'm sterile gloved. We've got this all filled with betadine, and we've got the solution. Okay. Again, because I'm right-handed, I'm going to use a fine motor of my right hand to do the cleansing. With my left hand, I'm going to keep the labia spread. Okay? So, in the video, unfortunately, it showed that they let go of the labia. Okay? Once you've given this hand up to be non-sterile, it's got to maintain the spreading of the labia. Okay? So, minimum of 3 wipes. Top to bottom on one side. Again, not going across here. Here. The other side. And middle. Now, I will tell you, there is absolutely no evidence based on which is right way. Side, side, middle, middle, side, side. I don't care what you do. Okay? My personal preference is side, side, middle. I like that last swipe to be right in line with meatus because that's exactly where I'm going. So it's my personal preference. You do not have to. Okay. So, and ideally, right, I mean the whole sterile technique, the whole sterile field will be here. Okay. So, now I'm getting ready to insert it. Miss Smith, take a deep breath. And I insert it here. Same thing, I see urine. I'm going to insert it 1 to 2 inches more. It's finished inserting, hold it, and then making sure that I inflate the balloon. Here's a challenge with females. It is not as visually accurate as this is. Many times you can't differentiate between the vaginal opening and the meatus. Very often, what will happen is we will inadvertently catheterize the vagina. So there's 2 things with this. One, you cannot take this out and then insert it into the meatus. It is not sterile. But 2, don't take it out right now. Because now I've got to get a whole new set. I'm going to get ready to insert. But now if I keep it here, I have a landmark. I know I have to go up. Whereas without this, I'm blind again. So as challenging as it is that you've used one Foley and you've catheterized the vagina, it's okay. It still can work to your advantage because you've got this. Now, you will never find anybody more fiscally conservative than I am. And I realize that hospitals have our business and they have to run on fiscal guidelines, okay? I do not ever want you to go, oh man, then I'm going to have to charge them another catheter kit and then use this, okay? Because let me assure you, the cost of the catheter is far less than somebody getting septic with this in the meatus after spinning the vagina. I mean, you know, do you want to have them be charged for like ICU or another catheter? I mean, yes, I want you to be conscious. I want you to be helpful as far as finances. But this is more cost saving, hands down, okay? Do not take this out and then insert it in the meatus. Okay? And then after that, you're done. Okay, questions?